The HoverSling Split-Leg is an air-assisted lateral transfer device and lift sling in one. This single-patient use product can stay under a patient, allowing seamless transitions between lateral transfers and vertical lifts. The HoverSling Split-Leg was designed to reduce cost and simplify patient handling by streamlining the number of devices used to transfer, lift, turn, and reposition a patient. Similar to the HoverMat single-patient use air transfer mattress, the HoverSling Split-Leg protects staff from injuries related to patient handling while providing a more comfortable experience for the patient. In this video, we'll show you how to safely utilize the product as a sling and as a lateral transfer device. The HoverSling Split-Leg has 6 red handles, 3 located on each side. The design of these handles ensures that the caregiver always remains close to the patient for safety. This is called the stay close approach. There are 6 sling support straps, 2 located on the inner side of each leg, 2 on the outer side of each leg, and 2 at the shoulder. These straps are color-coded for patient positioning and to match strap placement on the left and right side when attaching to a lift hanger bar. There are 6 storage pockets. Each one is located next to a sling support strap for use when the HoverSling Split-Leg is utilized with air. There are 2 sets of connecting snaps on the inner sides of the legs. These snaps must be attached when the device is being used with air. The HoverSling Split-Leg has 1 patient strap. This provides a sense of security and comfort for the patient. Always ensure that the strap is secured and not tight across the patient's body during lateral transfers. There are 2 hose entries, one on each side of the foot end of the HoverSling Split-Leg to make transfers more convenient. The hose is inserted into the opening and secured with a snap and Velcro closure. The label on the HoverSling Split-Leg indicates the foot end and patient side of the mattress. The single patient use HoverSling Split-Leg has a 700-pound patient weight limit. The HoverSling Split-Leg is compatible with any HoverTech air supply. When using the HoverSling Split-Leg for lateral transfers, always use a minimum of 2 caregivers. If possible, place the HoverSling Split-Leg on the bed prior to receiving the patient. Place a hover cover on top of the HoverSling Split-Leg to keep the surface clean. If the HoverSling Split-Leg is not already on the bed or stretcher, place it underneath the patient using a log rolling technique. Make sure that the patient is centered on the HoverSling Split-Leg and positioned with their head about 2 inches down from the top edge. Always ensure that the strap is secured and not tight across the patient's body during lateral transfers. Ensure that the sling support straps are tucked into the storage pockets and make sure the snaps are connected. Place the transfer surfaces as close together as possible with wheels locked, and ensure the bed heights allow the best ergonomic working height for the shortest caregiver. Transfers should be performed from a higher surface to a lower surface, approximately 1 to 3 inches difference whenever possible. 1 caregiver should be positioned next to the patient before the air supply is turned on. This caregiver should inform the patient of the task and explain what the patient will hear and feel. The caregiver will then insert the hose into one of the 2 hose entries by opening the flap and inserting the hose at a slight angle. The hose should then be snapped into place and the entry flap closed around the hose. Inform the other caregiver that it is safe to begin inflation. Turn on the air supply by pressing the appropriate airspeed button for the HoverSling Split-Leg. Once air begins to flow, the HoverSling Split-Leg will inflate and begin to cradle the patient. When the HoverSling Split-Leg is fully inflated, the caregiver on the sending side should begin the transfer by pushing the HoverSling Split-Leg at an angle towards the receiving caregiver. This reduces unnecessary reaching on the part of the receiving caregiver and ensures that both caregivers maintain an ergonomic positioning. To ensure the patient is centered on the receiving surface, 1 caregiver should remain close to the patient while the other caregiver performs a visual check at the foot end of the bed or stretcher. Move the HoverSling Split-Leg to center the patient as needed. The caregiver at the patient's side will then assume the position of safety and the other caregiver will turn the air supply off. Raise the side rails. The patient strap can be detached and the air supply hose may be removed. In addition to the log rolling technique, the HoverSling Split-Leg can be placed when the patient is seated upright in bed. This technique may also be used to place the HoverSling Split-Leg when the patient is seated in a chair. First, elevate the head of the bed and release the snaps between the 2 leg sections. Lean the patient forward and slide the HoverSling Split-Leg behind the patient's back until the apex of the horseshoe reaches the coccyx of the patient. Make adjustments as needed to accommodate the patient's height. Then have the patient lean back to hold the HoverSling Split-Leg in place. Slide the leg portion of the sling under the patient's thighs. Ensure the leg sections are appropriately placed under the patient's legs. Lower the hanger bar to attach the shoulder straps of the sling. attach the shoulder support straps to the hanger bar for the proper safety and comfort of the patient. It is important to match the strap placement on the left and right side of the HoverSling Split-Leg using the appropriate color-coded strap loop on each side. Using the shorter strap loops at the shoulder, blue or beige, creates a more upright sitting position, while using the longer shoulder and leg strap loops, white, will increase the patient's recline angle and reduce hip flexion. Cross the inside leg support straps by taking one leg support strap and passing it through the strap on the opposite side. Attach the inside leg support straps to the hanger bar. Next, attach the outside leg support straps to the hanger bar. Be sure that all 6 sling support straps are securely attached to the lift. Transfer the patient to the chair and verify the patient is properly seated. After the transfer is complete, release the sling straps from the hanger bar and return the sling straps to their pockets. The HoverSling Split-Leg transfer and lift device, providing seamless transitions between lateral transfers and vertical lifts. Please refer to the HoverMat Single Patient Use Split-Leg User Manual for detailed instructions for use.